have now a 65 years old woman with mediastinal neoplasia, compression of the middle esophagus. So we see on the barium contrast here, this is our stricture. It's almost 3.5 stricture. So the purpose today is to go with the gastroscopy, inspect this stricture and place a partially covered metallic stent. So we'll proceed with our gastroscopy now. So the setup of the room, we have the endoscopic screen in the left position of the patient, the fluoroscopic screen near the endoscopic tower. So I'm facing the two screen now. This is the upper esophagus. I push slowly my scope until I will see my stricture. We see the liquid in the upper part. We are at the 25 centimeter almost, and I think the beginning of the stricture is just here. I think I won't be able to cross, but I will try to cross. This is the compression. So the first thing to do now is to see where is our level of stricture on the endoscopic view. It's clear, it's at 27 centimeter. So we see our tip of the scope now. So we will be in the center of the screen. So this is the stricture, the level of the stricture. So I think I will I'll come back slowly. Okay, c'est bon. So now we will put our first marker, a radio opaque marker on the body of the patient. So this is our beginning of the stricture. I will just check again. This is the real stricture here beginning. So I will pull back slowly. So my stent will be inserted here. So this is my proximal part where I have to put my stent. Fixé. The first marker fixed. Now we have two choices trying to cross. To see the lower part, I won't do forcing for crossing. So what we will do now, we will take our cannula, put our wire in place. And then inject our contrast. We know that we have 3 centimeters. We have ready a partially covered Boston Scientific esophageal stent. So this is our cannula. So we will push our wire. It should cross easily the section. We see that we cross it now. So what I will do next step is to inject my contrast. So the other advice, in this case, it's easy. We cross it easily without any problem. But sometimes we have esophageal tumor, sometimes with fistula. So what we have to check is that we are in the stomach. So I have to see my اجي لنا شويه اهبط لوطه اهبط اجيني لنا زيد 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 دوس في الجيده. So this is زيد اهبط شويه زيد. So this is the most important thing to do. We see the stomach. حرك في الجيد حرك اجبد اجبد اجبد. So we see the looping. اجبد نحب نحب خدي نحب نحب. So we'll show you what we have to do. You have to see this loop in the stomach. Sometimes if you don't check the loop there, your wire may cross the tumor and you found yourself inside the fistula. So you will release the stent inside the fistula. Now we are sure we are in the right direction. So we'll come back to our marker. هرجع لك كما كنا اطلع. So this is our marker. So we see the tip of the, just we'll show you the tip of the cannula. It's near the scope. So I will cross, I think this is the level of the structure, and I will inject here contrast. We see the contrast going to the lower part of the esophagus, which is normal size, going in the stomach. This is a normal size, and I will just now inject on the structure, and I will pull back my scope, injector, and we see now the contrast locked in the upper part of the esophagus. You will see it clearly here. So we have now to measure our structure, and it will begin from the marker until here. This is what we have to cover. So if we pull back our marker, we have a 4 centimeter structure. Marker. So we will insert our second marker. So this is where the structure ends. So I will put it longer here, maybe. So my stent have to cover the two radio opaque marker. So now we will check the contrast. So we have the good mark on the contrast. The next step will be the exchange. We will leave the wire there. Take out the scope. The cannula is out. We are using 0035 guide wire. So I will take back slowly my scope with my two hands like this, and I will push. I will just focus the cam, and like you see my hand, I will do it by myself. I'm pushing the wire, and in the same time pulling back. I will check my guide wire. It's okay, and I will ask the anesthesiologist to just take care of my wire while I am out. So I am in the mouth now. The wire is sure in place, and I am out now. Should be feel good. So now I will release all the wire. The nurse will take it out. So the next step now, I will leave the scope there, and we will bring our stand. For today, we have a 12 centimeter and a 10 centimeter. We have this Boston Scientific Ultraflex. It's a partially covered one. It's a 10 centimeter length. We have 7 centimeter covered parts. So we'll finish by opening it. As we said, we have 3-4 centimeter to cover. This is our structure, and we have 7 centimeter covered part of the stand and 1.5 centimeter on each part which is not covered, which will help for the fixation, and we have less migration with this kind of stands. So we'll see. So we see the part here. So 9 centimeter, 7 centimeter covered, and On each part, 1.5 centimeter, it's not covered. So we take out our stent. This is our metallic stent. So what I like with this stent, we'll take the sheet from it. We will take our wire. I will explain to you. It's the easiest one to release, to insert. It's larger than the other usual stent. C'est bon. C'est bon. نهد خذ الكاميرا انت برا. شنفي. So we will explain to you now exactly what نمشي من جهة الهذي اللي هز الكاميرا. هذه اللي شد نقول لك كيفاش. وجه المريضة لا نهد خذ انت عليها. صور لي هكا يديا. قاعد ترى انت في حاجة غادي ما تنجمش هكا كانت. وجه المريضة هنا. C'est bon. So we explain now. This is our stand. We see the black part. I just will make another screen. So this is a full screen. We see better our stand. So if we see this stand, we have the black part here, and we will make some zoom. It's better. So this is ultraflex. So we have the black marker on it. This is the wire which is covering all the stand. And for releasing, we have this ring here. So if we pull the ring, we will deploy the stand by releasing the wire around the stand. So the first thing that we can do, so this is the tips and tricks we can apply easily if you are not comfortable with esophageal stand. So we will put our stand like this on the body. We see the two marker there. We see it clearly, the two marker on the body. And I want to know where are my marker on the stand. So I will put my stand like this here on the body. And I will just press the fluoroscopic view to see if my marker are okay. So you see the two marker there. So I will move slowly my stand and you see two marker. And I see the proximal marker. So now I have to just fix my marker. So if I look, so it's not the best setup for showing all that, but we will deal with it. So I want to see my stand is beginning from here to here on my hand, and this is what we will cover. So my stent is well placed, and we can now proceed to insertion of our stent, and we have all our marker. So we see the distal part here, which will help us to introduce our stent through the stricture. So now you know where is the beginning and the end of your stent. Just we'll put a video to explain. سيب 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 سيب. جيني من هنا انت جيني صور لي هذه ترى فيها صور لي هنا به اقرب وريني هذه من البداية هكا ترى فيهم هكا توري فيهم هذوما هنا. So this is the blue is the wire around the stent. This is the distal part, the proximal part that we will see on the endoscopic view. And all this is the uncovered part. We see clearly here the covered part. So we see here, this is the uncovered part. We follow, and we see this part. We will show it later on the video, the proximal covered part. If we follow our stent, this is the covered one, covered one, covered one, and here we see the beginning of the uncovered one. As we said, we have a 10 centimeter stent, but you have to know that the total length of the stent here is not 10 as we see it. We are at almost 15. كم نقيس الباقية؟ 15 وقفت غادي 15 هي رجع لي رجع أبدأ من هنا. So this is 15 centimeter. اوكي كم نطلع لفوق في الباقية؟ So we have here 5 centimeter more only for the covered part, and we are at almost 7, 8. So we have 23 centimeter length, because when we will deploy our stent, so now the next step is the introduction of our stent. So we have our wire in place. I will put some gel on the distal part of my stent. I will sure have some resistance while introducing. So what I will do, I will pull my wire, and this will help me to introduce my stent. Always we check the endoscopic view to see that the stent is advancing. So I have to see now my tips, distal tips of the stent. I have some resistance, but you see also that the wire is under tension in the lower part. So I will pull it slowly, and this will help me to correct my direction and to help to cross the upper part. We are still in the upper part. You see the distal part coming. I will pull back my wire. I'm sure I have a big loop in the stomach, and you see the stent coming now. I will push. I will feel some resistance. This is my stricture. I will pull back my wire, and now it should cross easily. And we see we crossed it now. I have still resistance, so I will take out my wire. And I have to cross all the structure. We'll pull back the wire still because the loop in the stomach is locking my wire. So otherwise there is no loop now. I have just to now to adjust my direction and it should be okay. We have the cardia there. So we have to cross our cardia. It doesn't want to cross easily. We wait a little bit, but it will cross. So sometimes it's more difficult, but we have to wait a little bit. The other thing that we can do is we surely cross it now, but I want to just push more because there's the فما حاجة مقلقتني قاطعة وجه هنا. سي بون سي. And it's moving as you see, and we cross it now. I have to see the two markers there. I will pull back my wire a little bit. So you have just to push gently your stand until we see this. So now we are well placed. So I will check the upper part. Peter. So this is my upper part. So I will be able to begin releasing, but if I want to be sure that I am in the right place, we will just introduce our scope to have the double control of the releasing, which is the endoscopic view and the fluoroscopic view. So we see our stand in the right side. This is the upper esophagus. So we have some resistance introducing the scope because we are in the upper part esophagus sphincter. I will suck all the liquid and try to see. I will wash a little bit. So this is what we want to see. I want to see the proximal part of the stand, which is here, the beginning of the metallic stand. I see my scope there. So once I will begin releasing, we have to check something important, which kind of stent we have. So there's two kinds of stent here. We have the proximal release and the distal release. This is the proximal release. So when we will open our stent, we will open this part, the proximal part before. The most important thing is to control the releasing and see it clearly because it will open just along the scope now, but you won't cover this part. The stent will go down. So once I will begin releasing, I don't need to move my stent as the other stent, but once I will open, we'll see two things now. I will see the stent going down. This is the covered part, the uncovered part of the stent. So for opening, for releasing, I will just pull on the wire here. And you will see the wire in the proximal part of my stent opening slowly. And you see this move, and just focus, and you will see the stent going down. So you have always to check, once opened a little bit, if you see endoscopic view, you see how it go down. I'm happy with this position because my marker is just 1-2 centimeters above the structure. So I will just pull it back a little bit, like this, and I will finish my releasing. I will advance a little bit my scope to have an endoscopic view of the releasing. And you see what's happening now. We are releasing our stent. It's opening slowly. And you see what's happening now. You see the stent opening. We will go in a little bit. We have covered everything. We are now in the middle of the releasing of the stent. I will pull back the wire and we see it opening on the level of the stricture. I will pull on still until the final release. If you see the two lower marker, I finish opening and the stent is fully deployed. So now the next step is to release, take out our stent, and you see how it's fully opened up. We are far away from the cardia, so we won't have any reflux. And you see the stent opening, the stricture is there. Of course, on fluoroscopic view, you will see my stent going there. I won't even try to cross it because I will be locked with my scope there, and I can maybe dislodge my stent. So the next step will be now contrast to check if we are okay. 5 seconds, stop. 5 seconds. زيد خلط زيد خلط خلط بالماء، زيد ماء، زيد خلط بالماء، صب الماء، طلعش تقعد تجبد هكا. ابدا فيق. So this is the last check. So we have to see the contrast crossing our esophagus, and you see the stricture there, and you see that we are just above the cardia. So I'm happy there won't be any reflux on that. And you see everything is crossing easily. So that, now the question, should I fix with the clips here? It's a partially covered one, so I think I will leave it like this, and it will be okay. So we'll sack all that, and this is the end of procedure. So my advice, if you want to be comfortable, always release on the double check view, the fluoroscopic one and the endoscopic one, especially if you have to deal with proximal release. I will put later the video of the stent details. So of course she will get antibiotics today and she will leave in the afternoon with a liquid diet for 2 days and mixed diet later.